Hello everyone, so this is a case report about Nicolau syndrome after endodontic treatment. We start with defining Nicolau syndrome, which is a thrombosis of blood vessels and damage of connective tissue, causing skin necrosis due to extrusion of foreign materials like calcium hydroxide or sodium hypochlorite into vital structures. This case report is about a 16-year-old female who presented to the department of maxillofacial surgery at Hamad Dental Center in Doha after receiving root canal treatment at another clinic. The patient reported that during her second visit for the endodontic treatment of tooth number 14, treatment was commenced without local anesthetics, but after preparation, she felt pain, so the dentist applied local anesthesia. After preparation, the canals began to bleed profusely, and because of increasing of the pain, he started trying to control the bleeding by injecting calcium hydroxide into the canals. But the patient began to experience severe pain and a slight change of the skin color on her left cheek in the region of the maxillary left first permanent molar. The next day, she developed swelling in the area where the skin had changed in color. She returned to the same dentist who prescribed antibiotics and analgesics, and the patient was referred to the maxillofacial surgery department. 3 days after the incident, the patient presented to the maxillofacial surgery department with a slight swelling, which is associated with hematoma on the left cheek. Also, she reported paralysis on the left side of the lips and excessive tearing from the left eye. 17 days later, the patient again presented to the maxillofacial surgery department with a necrotic patch of skin on her left infraorbital molar region, and she was scheduled with a plastic surgeon to assess and treat the necrotic patch. In addition, she was referred to endodontic department for assessment and completion of the root canal treatment. Endodontic department requested a CBCT scan, which revealed a dislocation of some opaque materials from the canals of tooth number 14 to the floor of the left maxillary sinus and reached to the area of the infraorbital foramen. After 6 months follow-up, successful outcome was indicated, and the patient's pain and soft tissue problems, they were both resolved. At the end, this paper discusses that the reaction of calcium hydroxide extrusion can vary from a simple inflammatory reaction to a serious damage. Also, they explain that immediate bleeding after injection of calcium hydroxide may be due to the proximity of the apices of the root to the blood vasculature. Also, hypothesizes that the extrusion of this calcium hydroxide caused direct trauma to the vital structures. Inflammation of the arteries and arterial embolism was occurred. Due to the crystallization of the drug occurred, which led to the ischemia and local necrosis.